And so it is time again for Medical Monday right here on eRadio. And as always, we chat to ophthalmologist Dr. Dylan Joseph. Today discussing EDOF, which stands for Extended Depth of Field Lenses. Big hello to you, Dr. Joseph. How's it going?
Hey, good morning, Ian. I had a good weekend, thanks. And how about you?
Also great, thank you. And looking at the end now of the month already, I just can't believe it.
Yeah, it's mad, isn't it? Hey?
It's
We're
crazy.
through the winter solstice.
Yes, and I just said to somebody, it feels like the Earth is just spinning faster and faster. I don't know if you're feeling the same way.
Well, they say it's relative, but it really feels real.
Everything's just happening. You think it is Monday, and then before you see it, it's Monday again. It's crazy.
It's Monday again.
It's insane.
There we go.
Anyway,
Medical Mondays.
Here we go, Medical Monday. So, extended
Right.
depth of field lenses. Can you tell us what exactly is it?
Right. So when we're doing cataract surgery, the old way of doing it was replacing the human lens with a standard lens, and you hope you're on target and for distance vision at least to get it as good as we can. And 99% of people ended up with spectacles. Then the technology got more and more advanced, and you get toric lenses to correct astigmatism, and then trifocals and refractive lenses. So they correct different distances. So trifocals meaning they correct 3 distances. Refractive means it splits the light into 2 portions, but extended depth of field lenses work on a number of different technologies depending on companies producing it. But it does exactly that. It doesn't just give you one focus point in the distance. It extends the depth of field. So if you're implanted with a standard monofocal lens, it means from 3 meters to infinity, that's your focus point. And everything from inwards of that is going to be slightly fuzzy, or you're going to need help with spectacles. Whereas extended depth of field lenses, they've got different zoom corridors built into them, or they have diffractive rings on the lenses to give you range up until about 60 centimeters. So from 3 meters in infinity, right up to about 60 centimeters, which is about the desktop range. So most of these lenses that work on a number of different technologies give you range up until about your computer that is mounted to the wall, not a laptop, not your reading book. So they often come with fewer side effect profiles than the other trifocal lenses, and so it might be more of an appealing option to people to go for something that we call a comfort lens. It's going to give you comfortable day-to-day vision, where perhaps for 85-90% of your tasks you're independent of spectacles.
Okay, and Dr. Joseph, can we use them with blended vision?
Certainly. So because they're set for a distance up to about the desktop range, if we set that in your dominant eye, right, you've got a good range of vision from distance all the way to 60 centimeters, and then in your non-dominant eye, which generally we can show you before surgery the effects of this, we then offset that to give you better vision from about your desktop through to your laptop. And the really nice thing about all the current extended depth of field technologies is that they all have that good intermediate range zone. So if you traditionally wear a monovision contact lens setup, right? So monovision means they only set for one distance. And in monovision contact lens, where you can only have one eye doing distance and you only have the other eye doing your reading or your laptop, which means you're missing out on your desktop range. So that whole 50 to 60 centimeters, 1 meter zone becomes a fuzz, becomes a blur. Monovision contact lens wearers generally get used to it, but also depending on their lifestyle, if you're an executive who's sitting 12 hours a day in front of a desktop screen, pure monovision is not going to work for you. And that's where something like extended depth of field lens technology would work, because it really hits that intermediate sweet spot range really nicely when you're blending the 2 eyes. So absolutely, you can use most of these lens technologies with the extended depth of field format.
Dr. Joseph, you mentioned side effect profiles earlier. Can you tell us a bit more in detail?
Yeah. So the one thing, and I think one of the major reasons why EDOF lenses were developed is because of previously intolerable side effect profiles of trifocals, like significant starbursts, glare, halos, at light, loss of contrast, low lighting vision is very poor. The modern day trifocals have certainly gotten on top of this and made those profiles or side effect profiles far less. But it's still important to warn our patients about those profiles, and generally it doesn't bother them. But these EDOF lenses, some of them will give very soft haloing, very faint haloing around lights, but generally to the point where no one really notices it. But most of them, the nice thing is that it preserves your night vision. So if you're doing a fair amount of night driving, you're unlikely to get glare and halos and starbursts. Unless you're doing the blended vision setup, which we talked about now, you will still notice some haloing and some glare with oncoming traffic. But worst case scenario with these EDOF lenses is that you can then get a balanced pair of spectacles for your nighttime driving or nighttime TV viewing, which takes those halos away, which if you remember from previous episodes, if you're getting trifocals, spectacles don't take those halos away that the trifocals cause at night. So we look at your visual needs, we see what side effect profiles can you tolerate, and if you're in any doubt, then that's when we go to the Vivior visual behavior monitor to show you really what your day-to-day visual requirements are and how much time you're spending at the different visual zones. And that gives us objective data. I think we've had a long discussion about the Vivior, and one day we can dive into that again and show you how valuable that is in helping a patient determine what's best for their life. But sure, there's compromise with everything, Jan, and I think whether it's night vision or low lighting reading or blended vision, for example, it's important to have these options on the table and to see which one is going to potentially work best for your lifestyle.
Dr. Joseph, in terms of cost, what are we looking at, the cost of the lens?
A lot of the EDOF lenses are now coming out very similarly priced to your standard monofocal lenses, which is great. So medical aids are covering a lot of them. Some of the EDOF lenses which I use, though, work on a very specific technology called X-wave technology, which is more expensive. So we'll often see that in the one eye, we've got a lens that is less expensive than the EDOF lens in the other eye, which is giving them more range. So people do get confused and they say, well, why is this lens so much more expensive than the other? And it's purely got to do with, one, the technology that's in the lens, two, the combination of the lenses that we're using to try and get you the best overall vision, and three, unfortunately, how the companies that sell these lenses onto us dictate the pricing. But there are still really, really good lenses available which are not going to break the bank, so to speak, and give you a result that may be equivalent to having trifocals in your eyes if you're not a good candidate for that.
So that, in a nutshell, on Medical Monday today is extended depth of field lenses. Dr. Joseph, thank you so much once again. I also firmly believe that knowledge is power, and that's exactly what we're trying to do with Medical Monday, especially when it comes to the human eye.
You're 100% right, Jan. I think where one would tend to slip up or have a problem with things like trifocals or EDOF or toric lenses, especially when it comes to cost as well, is if our patients do not know what their options are, what the negative effects are, what the positive effects are, and what the cost implications of the technologies are. And it's our job to enlighten our patients so that they can make the best choice. I mean, a lot of my patients always say, but doc, what would you do? Yeah. What would you do if it was your eyes, if it was your mother's eyes? And at the end of the day, I always say to them exactly the same thing I'm just telling you now. I, as the physician, can look at your eyes. I can say you'll be good for X, Y, or Z technology, or a combination of the above. This is the side effect profile of these different technologies. This is the benefit of these different technologies. But you, at the end of the day, have got to say, right, this is going to be something that's going to suit my visual lifestyle, and choose X, Y, or Z.
Exactly. Well, there we go. Thank you, Dr. Joseph. That leaves us with just one thing to do, and that's to get your contact details.
Yes, Jan, we're based in Knysna at the Advanced Health Centre, 4 Barracuda Street. Our local landline is 044-150-0085, and Mariska can take your calls and answer your questions about EDOF lenses. Our website is www.drdrdylanjoseph.com. And we have a number of social media platforms, including a YouTube educational channel where we've got a lot of great content there, which talks about trifocals, EDOF lenses, the Vivior monitor, etc. We've got a Instagram and a Facebook channel as well. So please go and give us a like and follow us. And if you've got any questions, we'll be happy to ask you.
Dr. Joseph, once again, thank you for your time and sharing your wealth of knowledge with us here on Medical Monday, and wishing you a wonderful week.
Yeah, big pleasure, Ian, and same to you that side. Stay warm.